It is the WEBO Morning Show, and Dave Radigan with you. And joining us on the morning show this morning, we say hello to our friends Nancy and Erica from the Addiction Center of Broome County. Good morning, ladies. How are you?
Good morning. Hi, how are you?
Very good, thank you. Nice to have you both on the morning show with us. Thank you for zooming in with us.
Absolutely, thank you.
It's been a little while since we've had the Addiction Center of Broome County on the air. So let's start with a brief overview of just what ACBC does in general.
Okay, I think ACBC is most known for their outpatient services for substance abuse. But where we come from is the Health Homes program. And we're going to talk a little bit about what exactly Health Homes is. I think a lot of people are confused about what it is. Actually, I feel like people are always like, oh, our home health people, and they think like we're nurses or something, or like are in the home. So I think me and Nancy just wanted to talk about like what it is, why it came about, and what services we offer.
Okay, well, what is it?
Well, it's a program that the goal is to coordinate services for our clients so that we help them to be healthier, they stay out of the hospital, less emergency room visits. We coordinate services so all their providers are more or less on the same page, and we're not duplicating services, and we're coordinating services to make sure that they're accessing services as well, because many of our clients are lacking in obtaining the proper healthcare services that they need to either become healthy or stay healthy.
We talk a lot about recovery and addiction and getting better, and there's a lot of different ways to do that. There's also a lot of different reasons why people ended up in the situation that they're in, and there's always underlying circumstances. It's never somebody waking up saying, oh, I'm going to try drugs today. It's never that at all. It's always some other underlying condition, whether it be environmental or medical or anything like that. You know, something drives people to abuse substances. And as we've spoken about in the past, you have to fix the underlying cause if you want to fix the substance use and abuse issue. And so that's where some of these other providers come in, and that's where you guys coordinate to make sure that the root causes are being taken care of so that the other help that you're offering is going to stick, right?
For sure, for sure. We work very closely with their outpatient counselors here at the Addiction Center of Broome County, and also we work with clients that receive services from other places besides the Addiction Center of Broome County as well. We're just not committed to ACBC clients. And we also have some clients that aren't even in outpatient treatment. They just have significant physical health problems, and we can work with them as well. We need to make sure that all our clients are receiving Medicaid in order to qualify for the program, for Health Home program. So they have to either be Medicaid eligible or have active Medicaid coverage for services.
Interesting. So dive a little bit deeper into this. What else are you guys doing with home health service? I mean, it does sound kind of like a home health aide, somebody that's going to come into your house and help take care of you.
I think what the ACBC Health Home like prides herself on is how hands-on we are with a lot of our clients. I think if you look at a lot of care management, you don't see them as involved as we are. And I think, like I said, we really pride ourselves on, you know, not just connecting our people to providers, mental, physical, but actually seeing it through. And seeing it through meaning like making sure we're there with them at appointments, making sure they get to appointments, you know, making sure that we're kind of that middleman that's able to help them see what the providers are saying, because let's face it, providers can be very confusing at times. So we're really that advocacy that they need in order to be successful in the community and on their own. So when someone comes into our program, as Nancy was saying, you're given a care manager, and you really sit down with that care manager and you talk about everything that's going on and everything that you would like to change. And it's a voluntary program. It's a program where you can work on whatever it is you want to work on. We're not here to tell you you have to get a mental health provider or you have to go to inpatient. It's just more along, it's person-centered, and it's whatever it is that they want to work on to better themselves.
We also work with them on getting safe and affordable housing.
Mhm.
A lot of our clients are either homeless or in situations that are unsafe where they can't afford it. So we work with them on housing. We also work on food security, getting them food from food pantries, showing them where food pantries are, how to access food pantries on their own. A lot of transportation needs are met through the care managers, transportation to appointments, transportation to go look at different apartments, just being that support person that a lot of people don't have at this time, and we're an extra person that can help them accomplish these things.
And alongside of that, I think, our main goal as a care management agency is to see our clients become independent on their own. The end goal being that they can do these things on their own and we can graduate them, and they can go on to just being independent and functional in society, really.
You want to have a high success rate. And in order to have that high success rate, you have to have follow through and you have to have accountability. And, it's sad but true, but a lot of people can either alienate themselves or become abandoned by their support system when they get too far down the rabbit hole. And they need some outside party that's going to come in and help them find the doctor, help them get there. Sit there with the appointment, help them interpret and ask the right questions. Because when you've got a lot of stuff going on, it's even harder to understand the words coming out of your physician's mouth about whatever the problem may be, or problems, because it's never one thing either. One problem leads to another, leads to another, leads to another, and you've got this tangled web that you need to, unweave to get to that point. So definitely. I mean, that's something that the Addiction Center of Broome County has been very good at with their track record of helping people get off of substance use and abuse. What else do we need to know about the Health Home program? How would we reach the program to get started? Or how do you have clients get into that program? Is it a different wing of ACBC, or is it, does everybody that uses ACBC become part of this, or is it just for a segment of that?
So that's a good question. I think we are right now in a separate building. I think the main ACBC is 30 West State Street. We're 477, which is right across the parking lot. Mm-hmm. But right now we have our very own person that enrolls people. Like, that's the main job that he does. And so if anyone was over here at the main ACBC building and asked about health homes, we know how to direct people. There's other ways. We have a phone number they can call, which is 607-217-5449. That's our direct office number. People can stop in. People can call over the phone and be referred that way.
Should we start with your program, or do we start with ACBC, and do certain people get referred up to you guys?
That can go either way. People could call in and say they just heard about us and they would like to connect with Health Home Services, and they could more or less do a self-referral. A physician's office can refer them. An insurance company sometimes refers people, emergency room. And then through ACBC, the counselors can also refer them if they decide that they want to start with outpatient treatment, and then the counselor discovers they have some more needs that maybe Health Home could help accomplish or get them services, then they'll refer over. So it can go both ways.
I just wanted to reiterate though, like if you're not in the ACBC outpatient, you can still be in the health home. If you're not somebody that struggles with substance abuse, you can still be in the health home. Like Nancy was saying before, you can have mental health, you can have physical health problems to make you eligible for that program. I think that gets confused sometimes as well.
Interesting. So again, phone number to get a hold of you guys in the health home program.
607-217-5449.
All right. Anything you guys would like to add this morning?
I think we hit it all, Nance. How do you feel?
No, I think we've given you a lot of information, and we hope that people call us, and because we can serve Tioga County, so we would love to have some Tioga County response from this interview, Dave.
Right. And it's not just Tioga County Addiction Center. Broome County, of course, is Broome County, Tioga County. You guys are doing a bit of Shenango County now as well, right?
Right. Right.
Yep.
Exactly.
So serve in the region for sure. Addiction Center of Broome County. Nancy and Erica, thank you for joining us this morning on the WEBO Morning Show.
Thank you for having
Dave.
us.